Hi everybody, my name is Michael Yoon. I'm one of the Fellowship Program Directors for the odd year. Thank you for your interest in our program. We look forward to hearing from you and hopefully meeting you.
Oh, hi. I didn't see you there. I'm Dan Lefebvre, oculoplastic surgeon, Mass Eye and Ear, and based mostly at the VA. And I'm excited to be interviewing you and hopefully working with you. You'd be spending time with me primarily in the operating room, where we perform a variety of different cases, regular eyelid cases, Mohs reconstruction, orbital cases, and endoscopic DCR, endoscopic brow lifting. And then of course we'd work together on call. I think we can have a lot of fun, but also work on some complex cases and learn a lot as we go. So I welcome the opportunity to meet you and look forward to it.
Smile. Smile. Okay, great.
You got the wrong credit.
All right, you guys. Can you all introduce yourselves, starting from Chris?
Me?
Yes.
I'm Chris. I've been working here about 6 or 7 years. Best part about working here is the crew.
Boom!
All right.
I'm Beth. I've worked here for 13 years. I think the best part about working here is not refracting.
Yes.
I'm Sue. I've been here for about 9 years. I will definitely agree with Beth. And we have a good crew, and there's always something different to do. You're not always doing the same thing in here. You're doing surgery or clinic, or it's always something different.
We show you the ropes.
And she'll teach you the TABs.
There you go.
Is it okay if I take this thing off? Hey everyone, my name is Edith Reshef. I will be your senior fellow if you decide to come here. It's a fantastic place. I'm really excited to start fellowship. We get to work with 4 really awesome faculty members. They're all really cool and fun to work with, and they all have a different teaching style and a different surgical style, so it's really great for building your own broad base of knowledge. We have a really wide variety of pathology here, so I'm just excited to get things going. Plus, Boston is a really wonderful place to live. I've lived here for many years now, and there's something for everyone. So there's sports, there's good food and restaurants, there's good nature, there's good winter activities, and the summers here are just like the best. So whatever it is you like, there's something for you. Good luck with the interviews, and hopefully we'll be seeing you here. So what's my favorite thing about Mass Eye and Ear, you ask? Well, this right here. The best ice cream ever, and it's just 1 minute away from the hospital.
Hi, my name is Grace Lee, and I am one of the attendings here at Mass Eye and Ear and preceptors for the ASOPRS Fellowships that we have. We would love to welcome you here, but unfortunately, due to the circumstances, we are offering you a virtual visit. I would say that some of the strongest features about our fellowship is the fact that we do have a very cohesive group of attendings. We do a lot of things outside of work together. We meet up, we have baby showers, and we have celebrations and birthdays together. So that, I think, engenders a lot of cohesion within our group. Also, I'm very proud to have trained a bunch of fellows, and we don't have like a cookie cutter type of fellowship where all of our fellows go into academics or all of them go into private practice. We actually have a good mixture of both. I would say about half or 60% go into academics, and the rest go into private practice. And so I don't think that you have to be one or the other to have a good training experience here and to be prepared for your next step in your career.
So we have our procedure rooms in this direction. They're right off of our patient rooms and off of our waiting area. And they're actually really nice. Patients love them. We have gorgeous views in them. We have everything we need for procedures in them, including an endoscope, cautery, whatever you need in a procedure room.
So one of the greatest parts about our office is we have this little kitchenette area. You have a kitchen, microwave, a toaster, a Keurig coffee machine that is always stocked with tons of coffee and even hot chocolate. As you can see, we have some donuts here today. There's always food near here, so you never go hungry. Attached to the patient offices up front, we have a little break room in the back with all the administrative offices as well. So we're just gonna walk on through here. This is Chris. She works directly with Dr. Lee.
I don't need this.
Because for me, it has to be in the afternoon.
Well, yeah.
This is Sean.
Hey, Sean.
Hi.
He works directly with Dr. Yoon.
I would really rather not be on film all along.
And this is Jean. She doesn't want to be on film, but she will be.
Wave, Jean.
One of the great benefits of fellowship here is you do get a pretty good cosmetic experience, even though it is a very academic center. And this is proof that we get good cosmetic experience. As you can see, these are cabinets full of filler that are provided to us for use in our clinics.
So this is our fellow workspace area. We have a computer here, drawers to put whatever we want, cubbies also just to keep our stuff in. And it's really nice and convenient to have this space here just to do work in between patients or at the end of the day. Basically whatever we need is here. One thing that's pretty cool is that all of our inpatients are just one floor upstairs. So it makes it very easy to see our patients if we have any admitted.
By the way, on the 10th floor too is our pediatric inpatient unit, and then we're going to take you to the adult one, which is just one floor up.
Okay, so now we're on our adult inpatient unit. So this is our inpatient unit here. All of our wonderful nursing staff and front desk staff here. So this is the third floor of Mass Eye and Ear. You'll spend some time here as well. As you know, Mass Eye and Ear has a very long history, and this floor you'll see all the portraits of people who are famous, who have been at Mass Eye and Ear. And the other things you'll find here are the library, the resident room, also the fellow room for fellows who are not oculoplastics, although we're totally allowed to hang out there as well. And most importantly, the wet labs and also conference space.
The places that you will find that you might want to spend some time is the library. And it has a full collection of every journal that you can possibly imagine, going back multiple decades. And so it's super nice and quiet in here. You have the ability to rent out books, including oral boards prep, written boards prep, anything you kind of need. And the librarians are really able to get you access to any papers you need when you're doing your academic stuff. Okay.
So this is our ophthalmology surgical wet lab. We have both an ophthalmology and an ENT wet lab, and as Oculoplastics Fellows, you'll be able to use both and spend time in both of them. Oculoplastics drawers has a lot of fake orbital implants that we use when we teach residents how to do enucleations. They're actually little bouncy balls. We have a ton of instruments in here that are just oculoplastics. So Cassies, Freers, malleables, Bowman probes, whatever you want. These are available here for use. So this is our eye pathology lab. It's also on the third floor where the wet labs are and the library is. And it's really nice to have iPath right here in the same building because you can always run in and take a look at your slides.
We all know that in oculoplastics we do have more inpatients than every other subspecialty. Fortunately, we do have our own inpatient units sometimes we have to co-manage patients with the Mass General Hospital. Fortunately, it's all connected on the second floor by a bridge with easy access. All right, this is the Liberty Hotel. It's literally across the street from Mass Eye and Ear. The importance of this place is there are a couple of restaurants inside. Had you guys been here for in-person interviews, we would have loved to take you here for food and drinks. All right, so we're inside the Liberty Hotel now. There are instances where we will have journal clubs here, and it's always a great time. As the Oculoplastics Fellow, you will actually spend quite a bit of time in the eye emergency room. There aren't many of these emergency rooms across the country, so it's a really good experience.
I'm the medical director of the emergency. I am here most days in the week. We see lots of trauma, tumors, inflammatory diseases of the face and orbit, and we work closely with the fellows who really enjoy coming down here and helping us with our patients every day.
I'm Dr. Joan Miller. I'm Chief of Ophthalmology at Mass Eye and Ear and Chair of the Harvard Ophthalmology Department. Our oculoplastics faculty rocks. They are the best service in the country, and it's just a tremendous experience. They provide great care for patients, have a wonderful, inquisitive view of everything oculoplastics, and just are a wonderful asset to our department.
So welcome to our operating rooms. We actually have 2 floors of operating rooms in this building. One of the floors is only for eye cases, and it has 5 rooms, so you can see them right here. The other floor, which is just 1 flight of steps down, has another 12 operating rooms, and is a mixture of eye and ENT cases. So as an Oculoplastics Fellow, you will be operating on both of these floors every single week. They're really nice because the nurses are all very familiar with eye and ENT, and especially oculoplastics. So let's take you inside just to take a look at one of these rooms. So they're pretty big, a lot of space here. Really actually nice to operate in them.
All right, so this is the surgical floor. You will be spending a lot of time here performing oculoplastic surgery with Drs. Freitag, Liou, and Dr. Yoon. Here's the main OR desk.
Where is she?
Is there a case going on 11?
No.
Cool.
Should we pop in?
Yeah, let's pop in.
This is Dr. Yoon's usual room. Usually he's in room 11. He has 2 favorite scrub techs, Letitia and Gail, and you'll get to know them very well. You want to be on their good side? They'll make your life a breeze.
Hi, I hope you're enjoying your virtual tour of Massachusetts Eye and Ear. I'm Suzanne Freitag, and I'm one of the program directors for our Oculoplastics Fellowships here. As you know, we have a fellow each year, staying for 2 years. We're really sorry that you're not going to be able to visit us in person this year, but we hope you'll get a good sense of what our facility is like, and I look forward to talking with you on Zoom for more direct interview purposes. A few words about our program. We see a lot of complex tertiary referrals here, so we have lots of interesting pathology, including a good amount of orbital pathology and thyroid eye disease, which has been really interesting with the new treatment options. We hope that you will think of some questions that you have for us when we talk with you on a video.